Okay, we'll get started. Thanks, everyone, for joining us. I'm Ryan Sateri, the Communications Manager here at the Brant County Health Unit. Here with me, I have Dr. Elizabeth Urbantke, Acting Medical Officer of Health at the CHU. Can we just do a quick roll call for all those joining us? I'll just have you state your name and your affiliation.
Vincent Ball, Brantford Expositor.
Samantha Lee, Brant.1.
Patty Berardi, Rogers TV.
Okay, thank you. In a moment, I'll turn it over to Dr. Urbantke to make a brief statement. If you could put your phones on mute if you're able to while she's making that statement, we'd appreciate it. We'll also save questions for the end. So I'll now turn it over to Dr. Urbantke.
Thank you all for joining us. I've usually begun these briefings by giving extended statistics related to COVID-19. These statistics are now available on our website every day and are updated at 11 a.m. I'd urge you to go there and find them if you already haven't. Over the past week, the number of confirmed COVID cases in Brant has settled, and we've experienced a much more gradual increase. While it's important to be cautiously optimistic at this point, we must keep in mind that this is not over yet. Due to COVID's prolonged clinical course, we are still experiencing cases and hospitalizations. This pandemic is proving to be like a marathon, and we are just beginning the race. But just as any athlete would, Brant has and continues to prepare for the road ahead. By washing our hands, physical distancing, and staying at home, our community has shown a collective commitment to these essential efforts. Doing so means we'll all reach the finish line together and healthy. I'd like to remind residents that now is not the time to be visiting cottages, cabins, or camps in remote areas. While it may be tempting to leave urban centers for more isolated places, this can place a significant strain on cottage country's healthcare systems and essential resources. Again, we understand that this is an interruption to how we live our daily lives, but we'll all need to watch out for each other, and we can do the best by staying in areas that have infrastructure set up to support larger groups of people.
Thank you, Dr. Urbantke. I'll now open it up for questions.
Dr. Urbantke, it's Samantha Lee with Brant.1. Can you speak to how well Brant is doing? I mean, 3 days in a row we haven't had a new case reported. Is it because we're doing such a great job at physical distancing, or is it that we've slowed in testing or getting our results back?
No, certainly we haven't slowed in testing. If anything, we've been ramping up testing as best we can. Certainly there's been more testing within the vulnerable populations. And I do not know the average wait time for testing off the top of my head, but certainly my team hasn't been informed me of any significant delays. And in fact, like just yesterday, I believe it was 90 negatives that we received. So it's not like we're not receiving any test results, but as I said, things seem to have settled. I'm hoping this is a trend that we're going to be able to see in the future, and we're on the right track. I want to thank once again all the community members for doing the best they can to meet all these public health interventions and help keep our community safe.
So if it's a marathon run, did I hear you right and say that we're just at the starting line now, or are we into the race?
Well, we're into the race, and as you know, this is not going to be over soon. We maybe get over a first peak, and then we may experience different peaks along the way until a vaccine or other treatments can be researched and brought to bear. So good signs right now, but I think we still have to take it slow and steady and keep practicing the interventions like we are.
This is no time for a sprint then.
No, I think as I said, we do need to pace ourselves and maintain what we're doing. It does seem to be working, but only time will tell.
Okay.
It's Patty from Rogers. A lot of people are saying it's not really here. It's not really a big problem in Brant right now because we're seeing the numbers sort of taper off. What is your message? I know that you've reinforced that we have to keep doing what we're doing, but there are people that I really believe in what I'm reading on social media is that they don't see it as a threat to them in this area.
Unfortunately, that's a misconception. It's a threat to everyone, no matter what age, race, ethnic background. We all have to be vigilant. We saw how quickly it initially creeped into our community, and if we let our guard down, this could creep back in again.
Okay.
Do we know if there's been any more issues with COVID-19 at the Brantford General Hospital?
I can't speak for the Brantford Hospital in regards to the outbreak there. The hospital is the lead for information regarding this, as they manage their outbreaks within the hospital itself. Certainly, we're working to support them, but any updates and information that haven't come from them for information within the hospital.
Okay. So to sum up your view, it's cautiously optimistic right now.
Correct.